Welcome to the penultimate topic in Unit 1, Section 3, Red Flags. In this tutorial, we're going to discuss red flags for the lower back. These are often glossed over but should be remembered every time we treat someone with a lower back problem. You will get a lot of clients come to you with chronic, non-specific lower back pain, so it's good to remember these. Red flags are a collection of signs and symptoms that should be taken very seriously. They can be an indicator of a serious issue that needs immediate medical attention. A report published in 1994 by the Clinical Standards Advisory Group, CSAG, identified a number of red flags for patients with chronic, non-specific lower back pain, which they subdivided into two categories. These are signs and symptoms that require emergency referral to a spinal surgeon, and signs and symptoms that suggest possible serious spinal pathology. The signs and symptoms for referral to a spinal surgeon are pretty clear, and you would hope someone with these issues would not be coming to you for help. But if they do, send them straight to A&E. These signs and symptoms are difficulty with micturition, having a wee, loss of anal and sphincter tone or fecal incontinence, saddle anesthesia. This is the loss of sensation around the anus, perineum and genitals. Widespread or progressive weakness in the legs and gait disturbance. I have never had anyone come to me with any of these symptoms. If you are at all concerned by a client's symptoms, send them straight to a medical professional. All this knowledge or signs and symptoms would come from your subjective history, so you can clearly see how important it is to ask these questions. The next collection of signs and symptoms are not clear-cut, and some would be quite common, but it's the severity of the symptoms, or the fact that it's constant, or the number of them, that then starts to raise doubts in the mind. I have treated many clients with some of these signs and symptoms. The more they have, the more it would start to flag a greater issue in my mind. Remember, if in doubt, do nout. Quite often, people with lower back pain have been to see their GP first, but don't take this as a sign it's okay to treat. Make sure you do your own full history, and if you have any concerns, send them back to their GP. If they have had scans and investigations and nothing is found, it would be fine to treat. I find it quite common for someone to have full investigation and nothing is found. Then come for massage or other treatment to try and resolve the problem. The signs and symptoms for possible serious spinal pathology are onset of age of less than 20 or over 55. You will see a lot of clients within these age ranges, and alone it's not a problem. Recent history of violent trauma. In this instance, get full details, and if you have any concerns, refer them on. Constant progressive non-mechanical pain. This is constant as well. It's 24/7. When you ask clients if their pain is constant, they will often say yes. You need to dig a little here, as often that's not the case. There will normally be times when the pain is diminished, such as bed rest, but if they insist it's constant, check they are sleeping normally. It's hard to sleep through constant pain. Non-mechanical pain is when you don't move and it still hurts, so bear that in mind as well. If they have thoracic pain, past a medical history of malignant tumours, prolonged use of corticosteroids, drug abuse, immunosuppression, HIV or they are systemically unwell, unexplained weight loss, persistent severe restriction of lumbar flexion, widespread neurological symptoms. This is one I would refer on very quickly. When there is a lot of neurological symptoms, I don't feel sports massage is the right discipline. Finally, structural deformities. This one on its own wouldn't worry me too much unless it's severe. Again, you can see the need for a thorough subjective assessment before you continue. This will give you so much information before you start your objective assessment. That covers red flags. Don't let this put you off treating someone with non-specific lower back pain. You can often bring them a great deal of relief and be part of the solution. And it's a very common problem. Just take care that you think about the red flags, take good history and treat if appropriate. You can now complete the quiz associated with this section and move on to effects on the musculoskeletal system from aging.